Hello, my name is Mehrotra. I'm the editor-in-chief of the Clinical Journal of the American Society of Nephrology, and I'm thrilled to be here with Dr. de Nattes. He is the recipient of CJASN Trainee of the Year Award for 2023. Tristan, can you please introduce yourself to the CJASN audience?
Hi, hello to everyone. So my name is Tristan. I'm a nephrologist and a PhD student in immunology, and I'm working in the kidney transplant unit at the INSEM Research Unit at Rouen University Hospital in Normandy, in France.
So what sparked your interest in diagnostic approaches for rejection in the kidney allograft?
So kidney transplantation rejection is a major cause of allograft dysfunction and loss. As you know, antibody-mediated rejection treatments are disappointing. In parallel, our understanding of pathophysiological pathways of rejection is growing thanks to recent high-quality studies and to the dynamic Banff working group. I believe that a refinement in diagnosis of rejection through molecular phenotyping could further help, as it can possibly define subtypes of rejection and potential evolution after treatments.
I understand. So with your research, what specific gap in knowledge were you hoping to bridge?
So molecular diagnosis of kidney transplant rejection is a hot topic with large cohorts extensively phenotyped at a molecular level. However, these molecular assays used in research studies are not available for routine practice as they are too expensive and difficult to interpret without a validated classifier or guidelines in the interpretation of gene expression levels. Here in this study, we aimed to develop and validate a molecular tool that checked all the boxes for daily use in a transplant unit.
So what did you find?
Based on a multiplex PCR, we selected a 17-gene panel that can be assessed in a single run. Secondly, we built an automatized classifier to categorize biopsies between antibody-mediated rejection, T-cell-mediated rejection, and no rejection controls. In the validation cohort, the overall accuracy score was 0.83. Best performances were observed for diagnosis of antibody-mediated rejection with a F1 score at 0.88, and sensitivity and specificity were both at 0.94. Interestingly, this assay can be performed on FFPE blocks in less than 24 hours, and reagent expenses are less than 20 euros.
Fascinating. If you take a step back, how would you say your work fits into the larger body of work? You know, there are different people working on different approaches to diagnose kidney transplant rejection over and above the histologic evaluation of kidney biopsy tissue.
So this study works on the applicability of a molecular tool in clinical practice. Also, several assays are available. They are clearly underused. This work gives to a kidney transplant centers the opportunity to equip itself with a molecular assay. We hope it will facilitate multicentric works, which are necessary to get the full picture of molecular diagnosis of rejection.
So what's the next step for your research? And more broadly, where should the field be going?
So now I'm working to work on the real-world impact of routine use of molecular tools in clinical practice. We have powerful tools for molecular assessment. However, we don't know yet when and how should we use it. Indeed, we don't know the clinical relevance of these assays. In which clinical situation will there be the greatest benefit from molecular assessment? What proportion of biopsies encounter these situations? How to incorporate molecular diagnosis into our current histological assessment of biopsies? How should we manage discrepancies between histological and molecular diagnosis? And in the end, does molecular assessment change patient management? I think that it is important to keep in mind that in the end, the aim of our research is to improve patient care.
Agreed. So what words of advice or wisdom do you have for people that are contemplating or just starting the research training with a focus on kidney diseases?
So we have top-level research from all over the world, and in my opinion, that can be quite impressive. But I think that everyone can make their own contribution. I think that if you might be interested in research, that means you should definitely give it a try. Don't miss out the opportunity to discover the world of the lab or clinical research. Put your ideas into practice, take advantage of the opportunities for meetings and exchanges that are more frequent than you might think, and surround yourself with caring mentors.
That's wise. Thanks, Tristan. Congratulations again.
Thanks.
I look
to you.
forward to seeing more of your work.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.